Hi, this is Dr. Kelly Mulhern from Thrive Wellness Center, and today we're going to be talking about migraine headaches. So, I'm going to start this webinar out a little differently than the previous headache webinars that I've done, and I'm going to talk and share a patient story with you. We'll call her Sally. Sally was in her mid 20s and she was a full time student obtaining a master's degree. She was a full time employee at a car dealership, working in human resources, so doing benefits and all hiring and firing and training and all that cool stuff. And she was a part time college instructor on the weekends and also a part time victim advocate. So she helped victims of violent crimes kind of understand the process and their rights in the court system and do some crisis counseling and intervention. So she had a lot going on, and she was in her mid-20s, and she started getting these headaches, which were migraine headaches, and she started getting them, once every couple of months. And over time, that increased in frequency until she was getting them 2 to 3 times a week, every single week. So she would go to her human resources job, and she would work until about 4:30, 5 o'clock. She would get in her car, she would drive half an hour home. She would typically make it home in time to vomit, and then she would lock herself in the bedroom. And the instruction to the family was, don't cook anything, don't have any loud noises, don't pester me, leave me alone. And she would try to sleep it off because she didn't believe in taking medication. So she'd try and sleep it off, and most of the time that worked for Sally, but sometimes she would wake up in the morning and still have the headache. But even if it did work, she still spent that second day feeling kind of foggy and really tired and drained and like she couldn't focus. And so that went on for about 2 years. But she just kept thinking, well, it's normal. It's just normal because I have a high stress life. I'm doing a lot of different things. I don't have time for myself. So that's just normal, right? Well, it's not normal. Migraine headaches are not normal. Any headache is not normal, especially when it goes on for years and years and years. Now, the kind of little piece of the puzzle that you may have figured out is Sally was me. So that's kind of my story as to how migraines impacted my life. I pretty much had no life. I would go to work and go home and sleep, and that was about it. So migraines are something that was very impactful on my life, and I'll tell you in a little bit what I did and how I eventually got through those migraines. So Thrive Wellness Center, here's some of the services that we offer. Now, I always like to start out by thanking you for taking time out of your busy schedule. Our lives are so hectic these days, and I definitely take my hat off to you for putting yourself first and taking some downtime to learn a little bit more about migraine headaches. If you have questions as we go, at the end I will provide my email address, and that's probably the best way to reach me. These webinars, I tend to try to keep them between 15 and 30 minutes. I never can quite predict ahead of time how long one is going to last, but somewhere between 50 and 30 minutes, keep it kind of short. A little bit more about myself so you can see my educational background. I'm a member of the Foundation for Wellness Professionals, so I volunteer my time with this 501c3 nonprofit organization to help educate our communities about health and wellness options. So I do talks like this in the community at no cost to help people understand what their options are and that they do have alternatives. By training, I'm a doctor of chiropractic, and I also have a master's degree in public health, and my focus was in epidemiology. So that was an almost 2-year postgraduate program where I spent a lot of time learning about infectious diseases, pathogens, transmission, vectors, treatment routes, viruses, bacteria, epidemics, pandemics, all that fun stuff. I am currently enrolled in a postdoctoral certification in functional medicine or functional wellness, and that uses advanced labs and testing to be a healthcare detective and really get to the bottom of why is somebody having an autoimmune issue, or why do they feel terrible but their labs are, quote, normal. So that is something that I'm super passionate about. I also have a postdoctoral certification in the diagnosis and treatment of accident-related trauma injuries to the head and neck. And I'm on a mission. So my mission is to help as many people as possible live happier, healthier, and longer lives with no drugs and no surgery. In my private practice in Tampa Bay, I can only see one person at a time, which is why I do talks like this and webinars like this, so I can reach a broader audience to help people make better choices so they can live that longer, happier, healthier life. So that is my mission. Now we're going to be talking about migraine headaches. That's just one type, and I've done several different webinars. So I've done a webinar already on stress headaches, on allergy and sinus headaches. I haven't yet done one on cluster or high blood pressure headaches, but I probably will in the near future. The last one I recorded was on hormonal headaches, and then today we're talking about migraine headaches. There is one more type of headache that I mention no matter what kind of headache I'm talking about, and that is a pathological headache. A pathological headache is one that is caused by something big, bad, and ugly, like an aneurysm or brain cancer or something like that. So when we're talking about some of these more serious types of headaches, we have got to rule those out first. Typically that person would come in and say something like, "This was the worst headache of my life," or they maybe have a history of headaches, but this one was unlike any they've ever had before. So those pathological headaches, again, really important to rule out. Now, a couple other little things. Any type of treatment for a headache is completely determined by the cause of the headache. So if we are treating a migraine headache as a hormonal headache, we are not going to be successful. So we have to know what kind of headache we're dealing with in order to proceed with the appropriate treatment. And as I typically tell people, it's like adding insult to injury. You can have more than one headache at the same time. So for example, you could have a sinus headache on top of a hormonal headache, or you can have a stress headache on top of a migraine. So that can make it harder to diagnose, it can make the person that much more miserable, and it can make it harder to treat. So we have to figure out what headaches you're having at what times in order to properly treat them. Now let's turn our attention to migraine headaches. Now, there are a bunch of theories as to why migraine headaches occur, and some of the mechanisms of migraine headaches are known, and some of them are not known. So, for example, we know that trauma can cause a migraine headache. For example, whiplash. I see a lot of patients in my practice that have had or currently have whiplash, and most of them will develop associated migraine headaches. Hormonal imbalances can lead to migraine headaches. Certain medications. I mean, there's a whole list of things that we know can trigger a migraine headache. And then there are other people that have migraines that are currently not really explained well by our understanding of migraines. Now, with a migraine, where do we feel the pain? Oftentimes that can help us identify what type of headache we're talking about. So a migraine headache can oftentimes have pain at the temple, behind the eyeball, or the forehead. Now, other headaches can also have pain in those locations. So again, it becomes important to kind of figure out exactly which type of headache we're dealing with. One of the important things to mention is that a migraine headache is oftentimes unilateral, meaning it usually presents on one side of the head. For me, it was always the right side, always 99.99999% of the time. If I had a migraine headache, it was on my right side. What can cause a migraine headache? A lot of different things. It can be a musculoskeletal issue. So for me, and I'll just use myself as an example as we go through here because it's one that I know inside and out. I worked, my day job, I was in human resources, and this was many, many moons ago before headsets were widely used. So I would kind of put the phone headset between my shoulder and my ear and kind of, bring my shoulder up to snug it there so I could leave it there so I could type with both hands. But I constantly had my neck at an angle. So musculoskeletal issue. This picture here is showing what we call an upper cross syndrome. So this is a known pattern of some muscles are tight, some muscles are weak, and you can see it goes kind of across the body in a pattern. So having that upper cross syndrome or trigger points in certain muscles can definitely trigger migraine headaches. illnesses and allergies, food allergies in particular, things like, or even not a true allergy, maybe it's a food sensitivity, like you're sensitive to red wine or chocolate, those can trigger migraines as well. Sometimes it's not just the foods, but it's the dyes or preservatives that are in the food that the food is prepared with. So you may not even know what's in there. But a common example of this would be MSG. So MSG is a flavor enhancer that is common in all types of Chinese food, as well as buffet food and prepared food. Can lead to GI upset as well as migraine headaches. So that's MSG, and that's one example. Some other common triggers in terms of food, as I mentioned, chocolate, alcohol, foods that are really salty, cold cuts because of the nitrites that are in them, as well as aged cheeses. Cold temperatures. So cold environmental temperatures, like if you are living in the north in the winter, or it can be, let's say you're sitting in a cold room and the AC is on. And that goes back to the musculoskeletal issue. As you're cold, your muscles tighten up. Those tight muscles can then lead to that migraine. Hormonal imbalances, another common cause, and that can become very tricky because in order to treat the migraine, we have to diagnose and test and balance those hormones. So it's very common for somebody with a hormonal imbalance to have a hormonal headache on top of the migraine headache. And those are two of the most miserable types of headaches, and they have them one on top of the other. So balancing out the estrogens as well as the progesterone can be of critical importance when we're talking about migraine headaches. Vascular, so our blood vessels and circulation play a role in most headaches. So if our blood vessels are too tight and are restricting blood flow to the brain, that can be an issue, or if they are too wide open and that is irritating the nerves that are wrapped around them, can be a problem as well. I've also read some literature about electrical imbalances in the brain. Kind of the wiring of the brain can cause migraine headaches. Fatigue, high stress, dehydration can all be triggers for migraines as well. Common signs and symptoms of a migraine, as I mentioned, it's often unilateral, which means on one side. Other than the fact that your head is throbbing and pounding, you may have a prodrome. So a prodrome is something that occurs prior to the onset of the head pain. Oftentimes people will refer to an aura. So the aura can look something like this, where their vision is disturbed. Some people will see really cool colors, or like a part of their vision is almost smeared or missing, or any kind of light can have almost like a halo around it. Other people will report sparkles or like kind of like flickering lights. So all of those can play a role. Oftentimes that prodrome will happen 30 to 60 minutes before the migraine. Can be longer, can be shorter. Everybody's different. I never, for as many migraines as I've had in my life, I have never once had a prodrome. Not once. No kind of visual disturbances. Now my husband, Michael, he will sometimes get a special subset of migraines, which are called ocular migraines. Ocular migraines can be really scary because you lose your vision when the migraine hits. So if you don't know that that's just a headache, you might think, oh my gosh, I'm going blind. And that can be really, really scary. So for him, his prodrome is that he starts to see those flashes and flickers of lights at the periphery of his vision. And he now knows as long as he gets adjusted and gets on ice and closes his eyes for about 20 minutes, if he can do those three things, he will avoid the migraine and avoid the visual disturbances or the continued visual disturbances. But if for some reason he can't do those three things, within about 30 minutes it's going to hit and he's going to be miserable. Can cause facial pain, oftentimes around the eye. Sometimes that you can literally see swelling in the face when that happens. Nausea and vomiting, extremely common with migraines. Of course, fatigue, vertigo. So that feeling of everything is spinning, as seen in the picture. Light sensitivity and noise sensitivity. I don't remember if I put it in here, but also the sensitivity to smell, which can then trigger the nausea and vomiting. So being super sensitive to those things. The visual disturbances can cause blurred vision, double vision, loss of vision. And another kind of scary thing is it can mimic a stroke. So sometimes people will have facial effects to where they're slurring their speech, or their mouth or their eye gets a little droopy. So it can be really scary, and that's where it's important to rule out. Remember, rule out those big bad uglies and understand, okay, is this truly a migraine, or am I dealing with something else? Now, how do we treat it? As with every headache, we have to address the underlying cause. So we have to figure out what that is. And there may be more than one cause. For example, I could have 10 migraines a month, and they could have 10 different causes. So having somebody keep a headache log or journal to document how they're feeling, when they're feeling, what they ate, and things like that can be crucial in helping to peel away the layers of the onion. So we have to address that underlying cause: musculoskeletal balance, hormone balancing, avoiding the triggers, deep tissue laser therapy we'll talk about in a minute, cool compresses or warm showers. That can help address the vascular component. Caffeine, same thing. Sleep. If the headache is at all caused by fatigue, then sleep can be really important. Or sometimes people just want to try and sleep it off. And then, of course, hydration, hydration, hydration. Now, structurally, there's a lot of things that can happen. Now, I mentioned earlier that I would kind of share the rest of my story. So I suffered with those migraine headaches 3 and 4 times a week for 2 years of my life, figuring it's just normal. Never saw anyone for it, never got any medication for it, not because I didn't feel that medication was the answer, because I knew that my migraines weren't due to a deficiency in, say, ibuprofen. They were due to my busy, hectic lifestyle. So I just, got up every morning and went through my day. So about 2 years into it, I was friends socially with a chiropractor, and we were out at dinner one night, and I was complaining about my migraines. And she looked at me and she said, "Kelly, I could so help you if you would just let me." And I remember I crossed my arms across my chest and I tipped my chair onto its back legs, and I actually rolled my eyes at her. And I said, "Michelle, the day that you can explain how you jumping on my back is going to help my head, I'll let you adjust me." And then, to my complete surprise, she did. She explained it all. She explained that in very summary terms, the nervous system runs and controls everything. And if you have a misalignment in your spine that's irritating the nerves, it is going to cause symptom and dysfunction. And the symptoms and dysfunctions that are caused completely depend on the level of the nerve that's being irritated. So she said, "Kelly, if you have an irritation to the nerves in your neck that can trigger your migraine, I can help." And I was blown away. I mean, I summarized what was a 3-hour conversation. I couldn't wait to get into her office. So I think it was within 48 hours, I was there. Johnny on the spot, sign me up. What do I need to do? And went through the whole process, the x-rays, the exam. Yes, I had spinal misalignments. Yes, I think I can help you. Okay, great. The day that she went to do my first adjustment, I was in the middle of a full-blown migraine. I can remember driving to her office thinking, this is a mistake. I should just drive home because I don't want to embarrass myself by vomiting in her waiting room. But I said, no, I told her I would be there. So I went. I did not embarrass myself. And I'm so glad I went, because it literally changed my life. That first adjustment was like somebody flicked a switch and my migraine just completely went away, like immediately. And I didn't understand it fully then, but now I understand it. My particular migraines were almost completely caused by a structural misalignment. And as soon as she addressed that structural misalignment, the headache went away. So I continued to see her as needed. And about 2 years into that, I was in a position in my life where I wanted to do something different. And I started to ask myself if I could do anything with my life. And there were no barriers, no boundaries. Nobody was going to tell me what to do or what I could or couldn't do. If I could do anything, what do I want to do with the rest of my life? And I didn't even finish the thought before that little voice inside was, I want to do what she's doing. I know I can help people. If I could help one person the way she helped me, it would all be worth it, because she changed my life. I didn't have a life before then. It was work, go home and throw up, and go to bed. And so once I started getting adjusted, it's like, man, I can go home and, watch TV or read a book or hang out with a friend. I'm not throwing up anymore. Like, yay, my immune system got stronger because, well, the adjustments helped every part of my body. So it changed my life, and I just knew that's what I wanted to do. So I did, and I haven't looked back since. And what seemed miraculous to me then is kind of every day for a chiropractor. And don't get me wrong, it is a miracle. Helping the body to help itself is amazing, and it's something that never gets old. But chiropractic care can be super important. So taking care of your spine, massage when there's trigger points or knots in the muscle that can impact circulation, can increase toxicity. Those tight muscles can, pull the joints out of alignment. So massage can be super important too. Acupuncture, another great option. Cupping, stretching, whoops, there's the needles. So lots of different options structurally. And deep tissue laser therapy. So deep tissue laser therapy uses certain wavelengths of light to stimulate your cells to make more cellular energy. When we have more cellular energy, we are then able in our cells to take that energy and use it for whatever the cell needs. Repair, regeneration. Side effects include decreased pain and decreased inflammation, soothing warmth. So most patients just love the way that it feels. There's no pain at all with it, and it only takes 5 or 10 minutes. But we have historically, when patients come in with migraine headaches, we can do 1 5 or 10 minute treatment, and it knocks the pain down in half or more. Sometimes they get all the way down to 0. So deep tissue laser therapy is another great option for migraines. Essential oils can help palliatively while we're figuring out what the causes are. Peppermint, really any of the mints, can help to increase circulation and kind of numb the pain a little bit. So those are the other cooling oils. Lavender can help neurologically reduce the perception of pain, and it can help reduce stress and anxiety, which may be contributing. And then any of the warming oils, this would really be looking at the muscles. So things like ginger, black pepper. I really love pink peppercorn. That's one I've been using a lot lately. You can see that the brand I prefer is doTERRA. There are several good brands out there, but I go with them because they are certified pure, therapeutic grade. A lot of their oils you can take internally, so I cook with them all the time. I never, ever, ever recommend going to a big box store or a third-party retailer for anything you put in or on your body. Too many cases of counterfeits. Too many times you pay for something that you didn't actually get, or you pay for something that's loaded with chemicals and toxins. And if you're going to put it in your body or on your skin, make sure it's pure. And that's why I love doTERRA. On our website, you can actually kind of follow the clicks and go through to an online doTERRA portal. In terms of supplementation, some supplements that may be helpful depending on the person and what their particulars are in their situation. Magnesium, that can help with the muscles. So that's the magnesium that I recommend. Vitamin D3 for overall cellular health. CoQ10 can be a good choice. B2 can also help. Again, with supplementation, though, it's not a cookie cutter approach. We have to figure out for each individual what supplement or combinations may be helpful, and if they can get it from their food or not. Now, I do not retail supplements in my practice. I use Fullscript, which is an online portal. It's free for me to use, and it's free for patients to use. So I can make a recommendation. The patient opens up their account, receives the email, and they can look at the supplements I've recommended. Fullscript gets paid by the nutraceutical companies who pay to be part of their portal. So they currently have, somewhere between 300 and 400 companies. A lot of them are physician grade, which those are the only types of supplements that I recommend are physician grade. So therefore, I can pick the specific supplement of the brand that I like, because, for example, I might like this brand's vitamin B, but that brand's vitamin C. So I can recommend the specific supplement of the specific company. and the patient doesn't have to run all over creation finding them. They can just look at them all at once and then decide what they want and have them delivered right to their home. I typically will have a conversation with patients if we're talking about supplementation, that it is important, if you're going to do supplementation therapeutically, that you spend your money wisely. And I would rather you take fewer supplements but of higher quality. And if budget only allows a certain dollar amount, then let's look at that and let's figure out how to maximize bang for the buck without going to a big box store and buying a cheap supplement that may not have in it what you need and also may be loaded with toxins. Now, my obligatory disclaimers. None of the information or options discussed in this presentation are intended to replace medical advice. So if you are dealing with migraine headaches, please, please, please find a qualified healthcare professional who is well-versed in headaches, holistic health, nutrition, supplementation, somebody who can best help you navigate these sticky waters, that can help you rule out the big bad uglies, help you confirm what kind of headaches you're having when, and what is the appropriate path forward. Every treatment option or supplement may not be appropriate for you in your particular situation. And of course, it's not recommended that somebody listens to this webinar, watches this webinar, and does every single thing in here. Work with somebody qualified and figure out what's going to help you. But I do encourage you, please stop suffering. Your body is not meant to have headaches on a regular basis. I wish somebody had told 20-year-old me that way back then. It would have saved me a lot of aggravation and suffering. So there you can see my email address that I promised at the beginning, as well as our phone number and our website, which we are constantly updating. So if you have any questions, please do reach out. And that pretty much wraps up today's presentation. I hope that you found the information informative and useful, and that you decide to take advantage of our special offer. This is Dr. Kelly Mulhern from Thrive Wellness Center, where we believe your body is designed to thrive.